Assalamualaikum and salam sejahtera to all my beloved friends. Let me briefly introduce myself. My name is Nurmalini binti Abdullah. I'm from OUM Petaling Jaya Centre. My matrix number is 900211065220001. I'm taking Nursing Science in Bachelor currently in semester 5. I am delighted to be here today to talk to you all about self-management during COVID-19. My talk presentation is divided into 3 parts. I will begin with what is the meaning of self-care. Then I will look at how we as a nurse to cope our stress level during this pandemic. And finally is advice for us nurses to apply in our daily life to avoid stress occur. Before I start my talk, I would like to ask, does anyone know how to self-manage yourself during this pandemic? And do you all know what is the meaning of self-care? Well, let me explain to all of you what is the meaning of self-care. The World Health Organization defines self-care as the ability of individuals, family, and community to promote health, prevent disease, maintain health, and to cope with illness and disability with or without the support of a healthcare provider. According to this definition, self-care includes everything related to staying physically healthy, including hygiene, nutrition, and seeking medical care when needed. It's all the steps an individual can take to manage stress in his or her life and take care of his or her own health and well-being. Whether you are going into work or working from home, the COVID-19 pandemic has probably changed the way you work. Fear and anxiety about this new disease and other strong emotions can be overwhelming. And workplace stress can lead to burnout external icon. How you cope with this emotion and stress can affect your well-being, the well-being of the people you care about, your workplace, and your community. During this pandemic, it is critical that you recognize what stress looks like. Take steps to build your own resilience and manage job stress, and know where to go if you need help. Since the COVID-19 pandemic began, we all experienced immense change to our lives and routines. To a greater or a lesser extent, this is bound to have an impact on our well-being. However, there are certain factors we know put some groups at increased risk of high-level stress. One of these groups is we as the frontliners. When facing stress and uncertainty, we each have different experience and do our best to cope. So, it's important not to compare your situation to the others. As a healthcare worker, you may expose to additional source of stress for a number of reasons, including intense and complex workloads, making it more difficult to practice self-care and connect with your support network. Challenges in your personal life that are difficult to deal with on top of work pressure. Physical tiredness and the restriction of working whilst wearing PPE. Worry about not being able to provide to distressed patients the level of care and comfort you would wish. Parenting and having to negotiate the demands of child care during lockdown. Feeling of isolation because of possible stigma and others' misgiving about the potential level of infection risks you may pose. You need to be aware of how you are feeling before you can find ways to cope with new stressful circumstances. The best self-care tips while working on the front line is paying attention on your own emotional, psychological, and physiological stress response. I do this by identifying how I am responding to stress. Many of that feelings that have been showing up for me at various times includes feeling sad, angry, anxious, tired, and frustrated. Once the feeling appears, I find a space to acknowledge the feeling. I will do this with myself or with my colleagues. Once I acknowledge the feeling, I can apply a grounding strategy to help me release some stress. Almost daily, I remind myself of my potential self-response and the strategies that I find effective to help me address my stress. Some examples of grounding strategies are breathing and noticing what you feel as you take time to intentionally fill yourself with air. Breathing can help me get back to a state of less intense emotion. My favorite strategy is to think about a resource in my life, such as my kids. They make me feel so happy. Knowing that in the end of the day, I can go home and play with them makes me feel more comfort. I also look forward to have a cup of coffee on my porch in the morning. Knowing that I can do that tomorrow floats me with feelings of joy and relaxation. So my self-care tip would be to pay attention to yourself. Identify your stress response and accept them as normal. Then list some grounding strategies that you can use anywhere at any time to lessen your feelings of stress. So, if you are experiencing increased stress, what you can do to take care of yourself as a frontliner? First, self-care. You cannot take care of others if you ignore your own feelings. Once you recognize that things are affecting you, you can find new ways to cope. Remember, even doing something small to look after yourself can make a big difference to your stress level. Self-care is hardest to do when you most need it. But as air passengers are instructed on flights, in case of emergency, you put your own oxygen mask on before you look after anyone else. Second, eat well and look after your body. And that includes not overworking. Make sure you get enough exercise as it is the single most helpful tools to help you to manage your mental health. Don't skip meals or breaks. No matter how busy you are, stretching or simply getting some fresh air can simply and quick way to mind yourself. Beware of the temptation to overwork and skip breaks before things are so busy. These are essential time for you to recharge, to be able to give some more. Third, connect to the supportive people in your life. You may find yourself somewhat excluded and isolated because of lockdown restriction and the work you do. Try to keep in touch with the important people in your lives as much as possible. Number 4. Are you fatigued and running on adrenaline? Watch out for excessive stress, fatigue and sudden exhaustion. Be vigilant about your stress level worsening. The feeling of being overwhelmed, feeling disconnected from your work and finding looking after yourself harder. Number 5. Compartmentalize. Avoid taking office workloads home as much as you can. You have very limited free time, so use it wisely. Spend time doing activities that energize you and leave you feeling refreshed and ready to keep going. Hang out with friends and family, go sightseeing, watch your favorite TV show or catch up on sleeps. Whatever works for you as long as you carve out some time to unwind. Here's a quick recap on the main points of this section. I would like to give some advice to you all in a view of we as a nurse is how do we manage ourselves and mental health during this pandemic? Firstly is please pay attention to and notice how you are feeling. Beware of your stressful level. Stress can accumulate and become overwhelming and chronic unless managed. Keep an eye on, monitor how you are doing. Remind yourself that feeling stress is normal under the exceptional circumstances we are living through. Seek for support if you find yourself unsettled. You may experience unpleasant and unwelcome emotion, maybe even towards patient. It may be that you are angry about non-compliance with social distancing restriction, or you are finding it hard to feel compassion. There may be times when you feel powerless. This is normal and to be expected. However, it is important that you reach out for support. The best self-care tips while working on the front lines is to know that it's okay to be not okay. I think we as a nurse feel the need to stay strong and unwavering so as to keep up this hero image. Although us standing resolved in the midst of crisis does give those around us a sense of security that someone has things under control, we must remember that we are still human. However, to be able to show up and give all of ourselves day in and day out, we have to be able to turn that inward and fill ourselves up. We must take care of ourselves so that we can take care of others. I hope my presentation today will help with what I said at the beginning. That brings me to the end of my presentation. Thank you for listening and your attention.